Chin, how are you today?
I'm okay.
You're doing? My name is May. I'm going to be your physical therapist, right? Which means I've been assigned to work with you, and I'm going to need to look at your shoulder complex, right? Is that going to be okay with you?
Yes.
Yeah. Is it okay if I put my hands on you also?
Yes.
Okay. That's all I need you to do. All right? Professor Chan has a whole different thing for you guys, right? Mine is 10 seconds tops, okay? Alrighty? I want to see you guys introduce yourself, alrighty? And make sure you're treating my patients, because does everybody speak English in the real world?
No.
No, okay? Alrighty? Do a lot of people have similar sounding names or even the same names? Absolutely. So you want to make sure you're treating the right Jin, alright? Because what do people tend to do when a person in a white coat walks into the room?
Just listen.
Listen and nod. Alright? And so if you're not really paying attention, alrighty, you could be doing a whole treatment on somebody that you were not supposed to be treating. That is like negligence at that point. That's a potential lawsuit. So be aware. Hospitals, they have a specific system. They actually say, are you so and so? They nod. Do you check? You have to check. Alright?
The wristband.
The wristband, and then ask them what?
DOB.
Date of birth. You have to ask them their date of birth. Likelihood of the same name having the same date of birth is very slim. Can it happen? Yeah, absolutely. So always make sure, okay? Alrighty? So I did my intro, and I'll do that sporadically throughout. Other times I'm just gonna get right into the lab just for time's sake, alright? So that is basically 10 seconds what I want you guys to do, okay? And, alright, so looking at the clavicle, obviously, I sort of see it, but not quite, right? So what I want to do is, can you just sort of round your shoulders a little bit and sort of make it pop out? So I got his clavicle right here. Relax now, okay? So I'm going to go from his clavicle, alrighty? Right? And I'm going to go towards the AC joint area, alrighty? So I'm going to palpate through. And should I be palpating on skin? Yes or no?
Yes.
Yes. All right. Never. Do you want your doctor to listen to your lungs when you're really sick through your sweater? Oh yeah. You want them to do that through your sweater?
They have to listen
Well, they have to listen, but do you want to have them listen through your sweater?
with a better diagnosis.
But not with the sweater on, right?
Oh, not with the sweater.
No.
Under the sweater. I'm
Under the
sorry.
sweater. Yeah. Right. Because when you get to
I'm nervous.
you guys are going to be
White coat
doing it with
anxiety.
Professor Chan, cardiopulmonary. Right?
Uh-huh.
Yeah, and you'll see why. You should not be listening with your stethoscope over somebody's sweater or t-shirt or something like that. That can construe your diagnosis or what you're listening for. Okay? So getting back to this, I am going to find the midpoint of his clavicle, and midpoint's always good because it's the most obvious part of the clavicle that sort of like sticks out. So I'm going to go laterally and a little bit posteriorly, and I'm going to go really slow. Alrighty? Alright, I got his humeral head right here, so I know I have to be away from that. Okay, how you doing? Am I hurting a
No,
little
no,
bit?
no.
Alright, I'm gonna just need to palpate a little bit deeper, but can you sort of bring your arm out a little bit? Just a little. Okay, a little bit more? And bring it back down? Alright, can you do it one more time? Here it is, okay. Alright, here's his roof, right here. Alright, the chromium process. Alright, so I'm gonna go slightly forward again. Can you bring it up again? Alright, there it goes. Alrighty, so what I felt a little lump as he abducted slightly. It sort of went away from my finger. Alright, so that's telling me I'm on his AC joint, okay? Anyway, should I be palpating for a very prolonged period of time? Like 10, 15, 20 seconds. No, because our bony prominences innervated.
Yeah.
Yeah, they're innervated. Right? So you want to be aware how long you're staying on that bony prominence because it's going to hurt after a while and he's going to get uncomfortable. Alright? So you want to be careful with that. Yes or no?
Yep.
Right? So that's the AC joint. So I started from the clavicle, worked myself lateral, righty, and a little bit posteriorly, alrighty? I found the acromion process, always find like the big guy, alrighty? And then you go towards the little guy, and bring your hand up one more time. Okay, and right here, his AC joint, okay? Alright, what's next? Oh, acromion process, alright? Just posterior to it, okay? The acromion process. Remember, it's the flat guy. And sort of practice a little bit on yourselves tonight, okay? With the palpation. Alrighty? Moving along, the coracoid process, okay? Alrighty? Get back to the clavicle again. Sort of go laterally. Alrighty? Alrighty? Alright? Now, it's deeper. Alrighty? So you just, remember what I said. Palpation, you want to start off superficially and then go a little bit deeper. So, what are you feeling right now, Jen? Am I going a little,
No,
a little
also.
tender?
Yeah, a little tender.
A little tender? Because I'm on his coracoid process right now. Alrighty? And he's feeling the tenderness from the soft tissue that's innervated and the coracoid process that's innervated. Because if I stay here a little bit too long, is that annoying you?
A little bit, yes.
A little bit. Alright? A little bit. That is annoying. Alright? So you could always sort of tell when you're on on a target. Alrighty? So bones get annoying when you palpate too long. So think about, everybody's going for a massage at one point, right?
Mm-hmm.
Alrighty? And they're right on your vertebrae. Alright, some of them, and they like to do that thing to sort of get into the intervertebral muscles. Can that be a little distracting
Yes.
in your relaxation during the massage? Yeah, can be. I mean, it is a good technique if you want to loosen up one of those intervertebral muscles. But if you're going for that Swedish massage relaxation thing, that can totally ruin it, because right around that small area, and masseuse is doing this thing on you, a lot of bony protuberances is right there, so it's going to bother you. So you want to be aware, all right? So that's why when we tell people we're going to do some palpation, look for bony prominence, start off superficially and work yourself in. Because if you just go like that into the bony prominence, it's going to hurt a little bit. And remember, patients are coming to see you because they're already in some discomfort, and now you're causing them more discomfort, all right? So you want to be aware. So looking at the clavicle, go to the lateral aspect, all right, as far as you can go, approximately a finger width, an inch down, right? And you'll feel that coracoid process right there. Alrighty? Yes or no?
Yes.
Okay. What's next? Sternoclavicular joint. Go back. Alright, get onto the clavicle. Again, go laterally. Alright. This is really easy. It's just right there. Alright. Can you bring your flex a little bit for me? Alright. Here, you feel like this ball-like protuberance, okay? A ball-like protuberance. Be careful over here, because what's over here? What's here? Your trachea, okay? Be careful, okay? Because you don't want to go too far, because what happens to that when you start palpating a little bit too deeply on your trachea? Choking. People don't like that. They're not going to come back to you. Alrighty? So be aware, okay? Know your anatomy. You're going to hear me again, I'm saying it. Know your anatomy. Certain things are like, a danger zone. This is a danger zone. People choke. They start choking. They start coughing. Right? Gets all over you. Right? You want to be aware of things like that. So to find the sternoclavicular joint, mid-clavicle again, and right over here. Okay? Alrighty? His is easy, alright? Because I feel like a big bump and then like an indentation right there. Okay? That's his SC joint. Okay? What's next? Deltoid. Okay. Deltoid. Alrighty? It's a muscle, right? Right?
Yep.
Are there other muscles right there in that area? So what you need to do is to sort of, facilitate it a little bit. So if you're looking at the anterior deltoid, what would you ask him to do? Flex a little bit. You would ask him to flex a little bit, okay? All right, so he flexed, okay? So flex a little bit, all righty? And I'm pretty sure I feel the anterior deltoid, okay? Right here. But can I be possibly feeling another part of any other muscles, you think? possibly, yeah. So you always wanna just, make sure, so you're gonna resist a little, go back down, okay? No, yeah, no, bring it all back down, sorry. Alrighty, just bring it up and just keep your hand here, thumb up, alright? Keep it on the side though, okay? Alright, flex a little bit and I'm gonna resist. Alright, and I will feel for his anterior deltoid going towards, where does it go? Insert?
Deltoid tuberosity.
Deltoid tuberosity. Alrighty? And what you're gonna see is sort of a little thinning out toward the medial aspect of his towards his deltoid tuberosity. You can see that muscle coming into play. And you guys, again, this is something you can do on your own too. So if I wanna do the middle deltoid, what would I ask him to do?
Abduct.
Abduct, okay? So I want you to try the same thing, all right? But just bring your arm out to the side now, okay? On the count of 3, 1, 2, 3, all right? Sort of feel it, and I could see it, all righty? I could sort of see it coming into play. His middle deltoid, okay? Relax. You know what? Next time you do it, sort of turn your palm up a little bit, okay? All righty? So try it one more time, all right? Turn palm up and abduct. More comfortable?
Yeah.
Yeah, okay? Again, so sort of remember, because what's he doing in the joint itself? He's starting to impinge a little bit, okay? And if I'm palpating for the muscle, or I'm not palpating for anything, you want to make them as comfortable as possible, because you're not going to be able to get an accurate sensation, all right, of the muscle or the joints if they're sort of, feeling some discomfort or pain, okay? For the posterior deltoid, what does it get to do again? It gets to extend, okay? So if he extends a little bit, alrighty, again, knowing your anatomy, it's gonna converge on that deltoid tuberosity. Alright, so it's gonna be right, okay, I got my hand in the right position. Can you extend a little bit? Alright, and I feel the muscle fibers coming into play, alright? And I could also feel that his posterior deltoid is not as easy to palpate, because most likely that's going to tell you it's not as easy to palpate. More likely, what do most people work on when they are doing in the gym? If they're working on the deltoid,
Medial.
the middle and probably the anterior part of it. Okay, alrighty. Most people don't do this. Why? Whatever. Okay. Alright. Most people don't. Okay. Good. Alright. So that's the deltoid, right? Alright, scapula. Okay. I could definitely do this in sitting, right? So you could stay like this, okay? He may be more comfortable if he's in what position? Prone. Alright, just to sort of get him to relax, and I could get all the landmarks in place. So I would usually, if I'm doing the scapula, and I have the ability to do it in palpate his scapula and prone, I will go prone. Okay? Which means what for your practical? What does it mean for your practical?
Do it in
Prone. Do it in prone. Thank you. Alrighty. So can you go on your stomach for me? It doesn't matter which side. It doesn't matter which side. I'll do this side. Okay. Do you want a pillow?
Yes.
Yes. Do you want another pillow for your stomach or anything like that?
No, that's good.
Alright? You could be your head in any old position you want. Okay? Alright? Whatever makes you comfortable. Alrighty? Now, like I said, pillows, for certain things, they cannot have a pillow. Alright? But if your patient is asking for a pillow and you're afraid it's gonna mess up the test or a palpation or whatever you happen to be doing on them, if your patient is asking for a pillow, give them a pillow, okay? Pillows are important for people, okay? Alrighty? In time, you guys will learn to sort of how to compensate for the fact that you gave them a pillow, okay? You want something for your feet or anything like that? My roll, okay, alrighty, he's comfortable, okay. I'm gonna put the book on the small of your back. Is that okay with you?
Sure.
Alrighty, be aware. Anytime you put your hands on them, alrighty, or you wanna put like lotion on them, okay? You always want to let them know, alright? Don't just put lotion on them, okay? Because most people tend to like that with the bottom. Is that a comforting sensation, even if it's warm or hot, warm or cold? That lotion, it's kind of like, ooh, what's that landing on me? Let them know, because can this be a precarious position for the patient? Yeah, because he can't really see now, right? Are you okay? Okay. Alrighty. You're gonna over there.
Yeah.
Okay, then I'll do this side so you guys can sort of see. So you guys come around over here. Okay? Alrighty, so, you know what, I'll just put this here, over here. Alrighty, can you just sort of put your hands in, I can see his scapula, it's right there. But I wanna get to the inferior border to make sure, if his scapula is not popping out for me. Can you put your hands in the small of your back, your right hand, sorry, your right hand. Ooh, look at that, okay, pop side out. Okay, put it down, okay, you can put it down, okay? So you have a general idea now where it is. So, your hand is right on the inferior angle. Your thumb side is what side?
Medial.
The medial, also called?
Vertebral.
Vertebral border, okay? And you're gonna wanna palpate all the way up it. And it can't get lost because there are layers of muscle, so you wanna be conscientious of that, okay? Alrighty, I'm palpating up. Alrighty, I should be nearing his scapular spine, okay? And how can I tell if I'm on his scapular spine? It's gonna feel what? Yeah, you're gonna be at the T3, T4 area. But what else? What else am I gonna feel under my fingers?
Hard.
It's hard. Yeah, it's bone. It's gonna be hard. So you're gonna be able to tell that. Am I on the supraspinatus or infraspinatus muscle, or am I on the scapula? Okay, the spine of the scapula. Okay, so looking at this here. Alrighty, so I'm still on the inferior angle. Alrighty, and he's winging a little bit. He's winging a little bit, alright, because it's very easy, because I didn't even need to have him put his hand in the small of his back. I found it very quickly. Alrighty, I am on the lateral side. My index finger's on the lateral side. Alright, so for the scapula, inferior angle is the big guy. Alright, that's the one that it's always going to be easy to find, and then you work your way around it. So I'm right here now. Alrighty, and I could feel the lateral border right here. Okay? Alrighty, so working it up, I feel his lateral border. Alrighty, and I'm on this side also. Okay. Okay, and right now, I can feel the spine of the scapula. Okay? If I'm gonna go towards the vertebral column, it should be some in between, anywhere between T3 and T4. We'll worry about that when we get to the vertebral column, okay, in a month, okay? But looking at that, I am gonna follow that spine of the scapula and should lead to what again? Where does it go?
Acromion.
Acromion process, okay? I sort of lost it a little bit. Moving up. Okay, moving along.
Could you follow it from the acromion?
Yeah, you can definitely follow it from the acromion too, one or the other. Yeah, and here's his acromion because I feel a flatness. Remember, acromion's always supposed to be flat, either in a horizontal position, and usually if it's gonna be tilted, it's gonna be more tilted, I think more like in an anterior direction. Usually it's more tilted in an anterior direction. His is pretty much flat. Okay, so that's what's looking at things. You can always find, if you happen to be sitting, use the acromion process to find the spine of the scapula. Okay, if he's in prone position, you know what? Use the spine of the scapula. All right, what you have. Okay, because when you're palpating, yes, I'm making poor Jin go from sitting to prone, and probably back up to sitting in a little bit. Is that going to be tiresome for a patient?
Yeah.
Yeah, absolutely. So, when you have your first patient, do whatever you can in one position first. Take your little mental notes of it or your actual notes of it, alrighty, and then move on. Because by the time you get them into a prone position and back up to sitting again, that might be it for them, okay? So be aware of things like that, okay? Alright? So move it, okay. So he's on his acromion process. I'm on his acromion process. Let me find this spine again. Okay, moving back. Okay, okay. So here I know definitely. So what's below? What muscle is below? Infraspinatus. What's above? Okay, what is covering the whole thing? The trapezius muscle, okay? Your trapezius muscle, after you get through the skin and the fascia and all that, your trapezius muscle is the first one.
It's the most superficial.
Yeah. So if you wanna palpate the trapezius, all right, that's the first one you're gonna feel. And what would you sort of ask him to do? If you're looking at the trapezius muscle, what would you ask him to do? Just see in this position right now.
Shrug.
You can see, yeah, oh, there it goes. Well, he actually protracted and retracted. So just sort of slide your shoulders up a little bit. Can you do that? There you go.
There it is.
Okay? Right, coming into play. Alrighty. If you want the lower traps, you can have them depress a little bit. We're not going to worry about that at this time. Alrighty? But if you want the supraspinatus or the infraspinatus, do we sort of have to sort of take that muscle out of the equation? Yeah? So you sort of got to dig a little bit deeper. And here's the spinal scapula. I'm just going to sort of palpate slowly in. Alright? And which one am I on right now?
Super.
Okay. Alright, it's not the greatest position for me to resist, so let's see if this works or not. Alright, and he's already, can you internally rotate your arm? It's really hard, huh? Yeah, okay. While you're here, what else can I do before I get you back up? Your latissimus dorsi. Okay, your lats. Okay, it's before I get you back up. What does your lats get to do?
Adduct.
Mm-hmm. And
Retract.
retract a little. Well, what's this? You are retracting. What's your humerus doing though?
Hyperextending.
Hyperextending. So, okay. Now, is your lats big?
Yes.
Yeah. Alrighty. So, is there other muscles in the way? Alright. So, what you need to do is palpate more for the tendon aspect of it. And where's that tendon? Where is it? In the general area. Where is it gonna be? Well, that's from the that's from one end. Where is it in the other end?
Armpit.
Huh?
Armpit.
Axilla. Yeah, in your axilla somewhere. Okay. So what you're gonna be doing, alrighty? Alright, I'm gonna be in his axilla area. Okay. Alright. So I'm gonna switch hands now. Alright. Because I'm gonna need to resist to get this. Because why would I need to definitely resist for this one? To make it pop up, because there's a lot of stuff here. Alright? So I'm gonna ask, can you sort of just push into my hand over here? Alright, when I tell you to, okay? I wanna get my hand in a position. Alrighty, so on the count of 3, 1, 2, 3, resist, resist. Oh, there it goes. And I could feel his tendon right over here. Do you feel me, by the way? Yeah, sorry. Okay? It's coming into play. Alrighty? Just let's just relax a little bit. Okay? Alrighty? So you wanna, especially as muscles, you gotta make it do something so it pop into your hand. Okay? Because yeah, you go like, oh yeah, I'm pretty sure I'm on it. But how do you know? Okay? And you wanna think about what's one particular action that it's only lats gonna do. Alright? And yes, when God made muscles do multiple things, that's good, because you could substitute. But the fact is, it gets a little bit hard when you want to try to distinguish it sometimes. Yeah, so you want to be a little, that takes the practice part. But what I'm here showing you is just the overall technique of doing it, okay? All right, what else? Okay, you know what, let me finish with the scapula and the supraspinatus and the infraspinatus muscle, and then we'll break, okay? So can you sit up for me? Okay? Are you okay?
Yeah.
By the way, what side should I have been on? Should I have been on, I was palpating on his right. What side should I have been on?
Left. Or his right side.
On his right side. I was just, so you guys can see. Alrighty, so don't always take the fact, because one student did, but you were on the right side when you were on the left side, Professor Tom. I told them, I said, more for the fact, so you guys can videotape. That's the only reason I'm doing it. Alright? So be aware, when you're palpating or doing any technique, doing intervention, anything like that, you need to be aware of your own body mechanics. I'm only doing it for whatever, 40 minutes, okay, on gym. And I'm not seeing a patient today. So that's what I'm gonna be doing. Okay, so it's not gonna bother me that much. But you're doing it all day long, yeah, it's gonna bother you. Alrighty, so, yeah, it's not showing up as much. So position did play in a row where the scapula came out. So can you put your hand in the small of your back again? Do you care if it's still on your right side? Is it starting to bother you?
No, it's good.
You sure? Okay.
I'm sure.
I got it. Okay, I got it. All right, you put your hands back. Okay, I got everything now. Okay, so looking at it, I'm gonna take. We'll do the infraspinatus first. Okay. Right. So I'm gonna try as much as possible to get his traps out of the way, as much as possible. And his erector spinae muscles out of the way. So I'm gonna just sort of palpate slowly but deeply in. And what does your infra get to do in life?
Some trash.
Huh? You just did. Ooh, yeah, and I felt it come right into my hand. So I'm gonna just resist a little bit, alrighty, and push. Very good, okay, and relax. Alrighty, so, you want a few? Yeah, put your fingers right here. Right, where my thumb is, sorry, my middle finger is. You can put more than one, because it's big. Alright, push right here, okay? And you can feel the muscles coming into play. If I want to do supraspinatus, alrighty, where is it? Alright, here's just, he's definitely, I'm much easier to find his acromion process than his spine of the scapula. So I'm gonna work my way back through here. Right here, okay. Alright. Alright, so you have your upper traps there. I'm gonna sort of slowly palpate deeper. Alright, now, alrighty, so, and sort of push the traps out of the way, you know, sort of get it out of the way. It's like take up the slack a little bit deeper. Can you just slowly bring your arm up towards like abduct a little bit, okay? You can bend your elbow to help if you want, okay? Like bend it to 90 degrees to help, okay? Alrighty, and I'm gonna resist, okay? So on the count of 3, 1, 2, 3, push, push, push. Okay, stop, because his traps are starting to take over. His traps and his, not his traps, his deltoid. So I'm gonna try to get this a little bit more. Okay, okay, push, just gently, 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 and yeah, I can feel the traps, not traps, supraspinatus coming in, okay? Little techniques, you ask it to do something with muscles, okay? Alright, what else can I do? Oh, the tubercles.
Is that using
Okay, the tubercles we're gonna do, alrighty? What is the, how did you guys find your tubercles last time? What did I ask you guys to do? Internally and externally rotate. So, alrighty, I'm gonna use his chromium process to find everything, because he has a nice one. I could find that very easily. Okay? Alright, so all you guys are sort of thinking that right now. Alrighty, I'm gonna go lateral, alright, to get on the humeral head, and I'm gonna go slightly anterior. Alright, so what I'm gonna feel, I do the 3-finger method, my index, middle, and ring. Alrighty, I'm gonna be at a slightly 45-degree angle, okay, between frontal and sagittal plane. Alrighty, and I'm just gonna ask you to bend your elbow, slowly rotate in, and slowly rotate out. Now keep your arm there, okay. Okay, I'm changing my fingers. It's not working for me this way because it's just the position. Do it again. Go all the way in. Good. Now go all the way out. Rotate. Keep going. Keep going. Go all the way. All the way. All the way. All the way. That's it?
That's it.
Oh, okay. All right. Go back in.
Why that face?
Okay. Try it again. Okay. Relax for a second. Okay. Just put your arms to the side. All right. Head. Anterior.
I'm too fat, I guess.
No, no, no.
Biceps too big.
Okay. All right, try it again. Okay, there you go. Okay. Now go back in the other way. All right, there's the hills and the valley. It's because it takes practice, okay? Even for me, I've been doing this for whatever amount of years now. All right, do it one more time. And what you're gonna feel, go out with one, valley, all right, and another small one. Go back in. Good. Alrighty, and you will feel that sensation. Alrighty, a lip, or a raise, then down, then another raise. Okay, because it's the hill, the valley, the hill. Okay, looking at the tubercles. Okay, the greater tubercle, the lesser tubercle, and in between the bicipital groove. Okay, so what you want to do, either using your clavicle or your chromium process, get to your humeral head area, okay? Get to the lateral aspect, because that's what you're gonna see right away. Get at a 45-degree angle, alrighty, using your fingertips, and have them internally and externally rotate for everything, alrighty? Now, yes, patients or people who have more musculature, yeah, it's gonna be a little bit harder, because what's in the way? Muscles. So you sort of have to palpate slowly and slightly deeper in to feel for everything, alrighty? And you have them go slowly, alright? At a pace that you can palpate. And it's not gonna happen on the first shot, alrighty? You may have them. It took me like 4 times before I finally was able to palpate this greater tubercle, lesser tubercle, and bicipital groove. Does that make sense? Okay, now don't go, because I forgot to show you guys this last time. Now, at the end of each section of the manual, alright, where is it? Ah, here it is. Alrighty, at the end of each section, okay. Alrighty, this is your competency, alright, that you guys are gonna be checking off